Every year, millions of older adults experience falls. And while a fall might seem like an isolated event or just a simple accident, for many people it represents a turning point. It can mark the beginning of a chain of complications, from a fracture or hospitalization to the loss of independence, the emergence of a fear of movement, or even the need for permanent assistance. But here's the good news: most falls can be prevented. And that's exactly what we're here to talk about today. Before we begin, let us know in the comments how old you are and which city you're watching from. Your participation is important and helps us create more useful content for you. Don't forget to like this video and subscribe for more health and wellness tips that can make a big difference in your life and in the lives of your loved ones. Let's get started. Why do falls happen? Falls are not an inevitable part of aging. While it's true that as we get older we may lose some balance, strength, or reflexes, that doesn't mean we have to accept falling as normal. Falls are almost always the result of a combination of factors: muscle weakness, poor vision, lack of awareness of the surroundings, certain medications, or simply a poorly lit floor. When we understand these risk factors, we can take action. In other words, there's a lot we can do to prevent a fall before it happens. Risk factors you should know. There are several factors that significantly increase the risk of falling. One of the most important is lack of physical activity. When we stop moving, our muscles weaken, we lose flexibility, and our coordination declines. Another factor is the use of multiple medications. Some medications can cause drowsiness, dizziness, or low blood pressure, all of which raise the risk of losing balance. There are also medical conditions that affect stability, such as diabetes, arthritis, or Parkinson's disease. Vision and hearing problems can make it harder to detect obstacles in the environment. And we can't ignore the condition of the home. Loose rugs, wet floors, poor lighting, or the absence of handrails in stairs and bathrooms can all become hidden hazards. Practical tips to prevent falls. The good news is that many of these risk factors can be modified. And the best part? You don't have to make major changes to see big improvements. Small, consistent daily actions can greatly improve your safety and quality of life. Here are a few. One of the most effective strategies is to stay physically active. It's natural to lose some strength or agility with age, but that doesn't mean we should stop moving. Quite the opposite. Movement is medicine. Daily walking, even if it's just around the house or the block, helps strengthen your legs, maintain balance, and improve circulation. There are also specific exercises to improve balance, such as standing on your toes, walking in a straight line, or doing slow movements like yoga or tai chi, which help train coordination and body awareness. No gym is required, no special gear, just consistency and a positive attitude, and your body will respond. Another key step is to review your medications with a healthcare professional. Many older adults take several medications at once, and this can lead to side effects like drowsiness, dizziness, or low blood pressure. Even common medications like sleep aids or anti-anxiety pills can increase fall risk. That's why it's essential to talk to your doctor or pharmacist to see if any adjustments are needed. Sometimes a simple change can improve balance and reduce risk without affecting the effectiveness of your treatment. We also can't forget how important it is to take care of your senses, especially your vision and hearing. Most people don't realize how much balance depends on accurate visual and auditory perception. A misjudged step, an unnoticed puddle, or a sound that startles you from behind can throw you off balance. That's why an annual vision checkup, updating your glasses when needed, and using hearing aids if necessary isn't a luxury. It's a vital part of fall prevention. And of course, there's the place where we spend the most time, our home. Many falls happen there, not because of carelessness, but due to small details we overlook. For example, a rug that slips, a cord running across the hallway, or a lamp that doesn't light properly. These are small things, but they can be dangerous. The recommendation is to inspect your home with fresh eyes, as if you were seeing it for the first time. Make sure all areas are well lit, especially staircases, hallways, and bathrooms. Install sturdy handrails on both sides of the stairs and place grab bars near the toilet and in the shower. Night lights that turn on automatically can also be very helpful if you get up during the night. As for footwear, many people don't pay it much attention, but it's a key factor. Ideally, wear closed-toe shoes with non-slip soles and good support. Avoid loose slippers, open sandals, or high heels, as they can cause your foot to slip or lose stability. Even the habit of standing up quickly from bed or a chair can cause a fall due to a sudden drop in blood pressure. That's why it's recommended to do it in 3 steps. First, sit on the edge of the bed and wait a few seconds, then place your feet firmly on the ground, and finally, stand up slowly. This simple habit can prevent many scares. In summary, fall prevention doesn't require major investments, but it does take attention, awareness, and small daily actions. Taking care of yourself is a way of loving yourself, and of preserving your autonomy and freedom to continue enjoying life with confidence. Fall prevention isn't just about avoiding an accident. It's about protecting your independence, your health, and your well-being. Every small step you take today can help you avoid major complications tomorrow. It's not about being afraid to move, it's about moving safely, confidently, and joyfully. Remember, preventing falls is possible. And you're not alone in this journey. Family members, doctors, and therapists can help you. What matters most is taking action now. Don't wait for a fall to happen to make a change. And that's it for today's video. Now tell me, did you imagine that small changes in your daily routine could have such a big impact on your physical well-being? Let me know in the comments. I'd love to hear your thoughts. If you found this content helpful, share it with your friends and family. Someone close to you might need this information too. And of course, don't forget to like this video and subscribe to the channel to keep receiving valuable tips that can transform your day-to-day life. See you in the next video.